Hey, good afternoon, everybody. Chris Lester here. Today's topic is going to be on Medicare. So what is Medicare? Medicare is the largest health insurance program offered by the U.S. It's run by the Centers for Medical and Medicare Services, so CMS as I know it. Medicare is a federal health insurance program. And, for people in the U.S. who are 65 and older, as well as some people that are younger with disabilities. Enrollment is processed through the Social Security Administration. So Medicare eligibility, you must be 65 and over, a U.S. citizen, a legal resident living in the U.S. for 5 years or longer. Those who are age 65 who qualify for Social Security disability. So if you're getting Social Security disability, you're eligible for Medicare. And at age 65, you're eligible for Parts A and B, even if you still work. And you may be eligible for Medicare, though your spouse, although they still have to qualify by age or disability. And you may also qualify for Medicare's Part A and B if you're under 65, again, if you have a disability. So just think about it like this. If you're 65, you're eligible. You're eligible earlier if there's a qualifying disability. So Medicare has 4 parts. These are the 4 federal parts, and they're titled A, B, C, and D. So A and B are on the left side of your screen. We're going to go into that in detail. So you got hospital coverage for A, doctor's visits for B, and then C and D is where it gets a little bit muddied and people start to get confused. And we'll get into that a little bit as well as we move forward. But Part C was created and is called Medicare Advantage Plans or MA plans, right? And then you have Part D. D is for drugs, so Medicare prescription drug coverage. But this section, the right side of the screen, is provided by private insurers, not the federal government. So if you look at the left side of the screen, there's a lot of numbers here, but there's a lot of good information here. Part A cost in 2020, monthly premiums, you see that it says 0. And that's because while we were working, most people, very rarely will somebody have a premium because they didn't contribute into Part A. You paid for it already. You have a deductible. You look under that once a year, $1,408. That's subject to change as Congress legislates into the future. Then you see hospital stays. So up to 60 days. If you go into the hospital and you have Part A for 60 days, it'll cost you nothing. 61 to 90. So imagine, is there a circumstance where you might need to be in the hospital for longer than 2 months? For severe ailments, when my dad had pneumonia, he was in there for like 3 weeks, right? Twice. So, you think about a severe car accident or surgery, it's absolutely possible. So if you're in there between 61 and 90, that's $352 a day. That's a hole in the insurance plan. That's an unknown that most people aren't aware of. It's an exposure or risk. Then day 91 to 150, it goes to $704 a day. So you think about it, $700 a day is a lot of money. But then a semi-private room is going for $2,500 to $3,000. So if you're in there for more than 150 days, it could bankrupt you. So that's just for the hospital. That's for basically the bed, right? The room, the 4 walls, the ceiling, and the bed. Then you have skilled nursing, right? This is very important language here. So when we use the term skilled nursing, that means somebody that's putting in IVs, checking your blood pressure, giving you your meds, doing those types of things. So days 1 through 20, there's no cost. Days 21 to 100, it's $176 to pay for that skilled nurse. And then after 100 days, it's 100%. And so this is all on Part A. So although there's not a cost, there's exposure. Okay, now let's go to the right side of the screen, Part B. Remember from the previous slide, this is doctor's visits. So your monthly premium right now is $144 for most people. If you're a married couple filing jointly, making under 170, about 170, 180 grand a year, right? Then your premium is $144 today. But it is means-based testing, which means that they are looking back at your income and they are going back 2 years to collect those tax returns, and it's based off MAGI, Modified Adjusted Gross Income. So if you have a year where, like right before you retire, and maybe you were had acquired some stock options along the way, and you've exercised in some of these options, and you got a severance package and all this stuff. As you separate from work and they ask you for your tax returns, you could find yourself paying an exorbitant amount of money for Medicare. So you have to keep a close eye on that. And then Part B deductible is $198 a year. Again, this is for doctor's visits. If you are still working, right, and you don't file for Social Security, but you enroll in Medicare Part B, you have to cut a check. But if you elect to work and collect Social Security, then they will debit it from your Social Security check. And then Medicare pays 80% of doctor's visits. So I spent a little time on that slide because there's a lot of information, and this is just the federal part. This is the one where you see the United AARP will send you the stuff, and the person that's sitting at Costco or at Walmart at open enrollment that wants to sign you up. Medicare Advantage plans, the federal government has partnered with the private insurance industries and said, look, we want you to quarterback it. We want you to take care of everything. And this is where I want to caution, is because there are plans out there that are zero premium plans. Doesn't that sound awesome? Well, what do you know in this world that's actually free? I mean, is insurance free? The answer is no. So who's paying it? The federal government is paying the insurance company the premium. And if there's $0 premium to you, the consumer, where's the gotcha? And the gotchas are typically in the coinsurance and the deductibles and the maximum out of pockets. So you really have to go in and look and dissect this. So you have health plan options approved by Medicare. They're also called Medicare Part C. They're run by private companies. Medicare pays the amount for each member's care. May have to use network doctors or hospitals. So think of it, most of the plans out there, there's some PPOs, but most of them are HMOs. Then the plans maybe include prescription drugs, right? So if it's an Advantage plan and it has a PD, that's a prescription drug plan attached to it, they're basically quarterbacking A, B, and D into one plan under this C. May include extra benefits. This is where it can be attractive to somebody that's not forward thinking in their needs. They say, oh, I need vision. I need dental. Well, companies like Aetna or AARP that offer these Medicare, even Horizon that offer these Medicare Advantage plans, can offer these ancillary benefits as part of their program, but it's not part of Medicare. I just want you to understand that. And then plan may include prescription drugs that have these extra benefits, and benefits cost sharing may be different. So drug plans, Medicare stands for D. It's prescription brand names and generic drugs that are approved by the FDA. They use formularies. And part of what we try and do if we're helping folks with this is we want to take a collection of drugs that you may be currently using. Depending on what is the best fit for you, then we want to go through and help you to figure out, which drug plan is going to overall lower your exposure. It includes drugs, biological products, and insulin. Commercially available vaccines not covered by Part B. So it tries to be comprehensive, but there are a lot of rules around the drug plan. So what does Medicare not cover? And the number one thing, and I talked about this last week, and I want to drive this nail home. I had shown on this slide earlier that Medicare Part A in the hospital will pay for a portion of skilled nursing. Well, long-term care is not skilled nursing. That's eating, transferring, toileting, continence, transferring, all these 6 ADLs, activities of daily living. That is not covered. And quite often somebody will think, children of parents will think that, oh my God, they're telling me it's going to be $175 a day, $200 a day for mom or dad to be in this facility. Does Medicare cover that? The answer is no. If you're outside the U.S., you're traveling. Now, in emergency circumstances, yes, but typically care delivered outside the U.S. is not covered. And as you can see here, notice Medicare does not cover the dental, the vision, the hearings. It's a Medicare Advantage plan that the insurance company is sort of wrapping some of these additional benefits, but Medicare in and of itself doesn't cover it. Cosmetic surgery, acupuncture, amounts of Medicare approved over the approved amount. So sometimes some doctors might charge too much, or you might go out of network. They're only going to pay so much. And then amounts not covered by deductibles and coinsurance above that 20%. So how to sign up for Medicare Parts A and B? Well, write this website down, www.ssa.gov. There will be some challenge questions. Whenever you go to Social Security, they're going to verify your identity. And I'm going to tell you, take your time with answering these questions. Because if you get it wrong, they're going to lock you out. I think it's 48 hours. Or you can call Social Security. Automatic enrollment for those receiving Social Security. So if you're already receiving Social Security, maybe you lost a spouse and you're receiving widower's benefits, or you're on disability. If that's the case, you're auto-enrolled. But initial enrollment period package are mailed 3 months before 65, then the month that you are 65, and then 3 months after, right? And this is why you start to get all that mail as you approach retirement from AARP and all the vendors. The best time to enroll in Medicare: to avoid late enrollment penalties, sign up during the initial or special enrollment period. To avoid gaps in coverage, sign up before the current coverage ends. So it depends on your circumstances. There's open enrollment, and then if you miss that, then you have the special enrollment period. So if you sign up during these months, right, you sign up in January, February, or March, right, your coverage will begin on July 1st. If you miss the initial enrollment period, you can still sign up the following year during the general enrollment period, which is January 1st to March 31st. But that coverage will not start for another 3 months, right? 3 to 4. Then the special enrollment period is for people who did not sign up for Parts B and D during their initial enrollment period because they were covered as a worker or spouse of a current worker by a large group, which is greater than 20 employees group plan. So special enrollment period for Part B, anytime before the coverage ends, right? So that means if you have coverage and your spouse or you are working, then there's nothing to do. You don't have to do it. You don't have to pay that premium, $144, right? Then if you do, for whatever reason, you retire and you say, hey, I'm done, or your spouse retires and your credible coverage is running out, 8 months from the date that group coverage ends. That's all the special enrollments. That's called the qualifying event. Then special enrollment period for Part D, anytime before coverage ends and within 63 days of the coverage ending. So that's for the Part D drugs plan. There's different timelines. So if not automatically enrolled, your 7-month initial period, this is what I was talking about before, right? It's the 3 months prior, so 3-2-1 of the month that you turn 65, and then the month of, and then 3 months after. So for a total of 7 months of this enrollment period is available. Now, if your birthday happens to fall on the first of the month, then your eligibility starts the month before. All right, so how to sign up for Medicare Part D. Decide if you want original Medicare. This is going back to that slide where I was breaking it down into to the left and to the right. So you had A and B on the left, which is federal government, and then C and D on the right, which is private insurance. So decide which direction you want to go for drugs. Do we want Medicare Parts A and B, and we're going to buy a standalone drug plan and a supplemental, right? Or do I want a Medicare Advantage plan, something like an HMO or a PPO that's going to quarterback everything, and I'll either use their drug plan or something standalone if available. If the original Medicare shop for standalone prescription drug, that's called PDP, right? Prescription drug plan, right? If enrolling in Medicare Advantage plan with the drug coverage, that's MAPD, which is Medicare Advantage prescription drugs, shop for the plan. So apply for Part D through Medicare.gov. So you can go out there if you wanted a standalone drug plan, you need help with this. Again, you can always pick up the phone and call us. But here's how it works, right? So Part D, the middle column, so annual deductible is $435. That's just what you're going to have as a hard cost out of pocket before the insurance kicks in. But your premium is $0. But because of the deductible, it's $435. If you have a $435 pill, you paid $435. So just keep that in mind. Now, the next line says initial coverage period. So that's 75%. This starts to get into something called the donut hole. So initial coverage period, 75% of this 35.85, which means that the Part D plan pays $2,600, you pay 25%. So that right column, you have $1,000 in this example as a cap out. The coverage gap, this donut hole that I just mentioned, this is the sort of threshold that you have to get through, exposes you to a little bit more cost. And then if you have catastrophic coverage, right, then it will go ahead and pick up 95% of the drug costs minus the copay. So what I find is most people that have questions about their drugs are people that are using and have a need for drugs. People that aren't thinking about it go, well, I don't need anything. But you have to caution that line of thinking, because even though you don't need the drugs today, we could need them in the future. So we have to make sure that we have the potential to offset any exposure and risk. So out-of-pocket costs paid by Medicare. So the premiums for Part B are paid to Medicare. So private insurance premiums for Part D, drug plans, Medicare Advantage plans. Then you have other out-of-pockets, which are the deductibles, the portion of the doctor's bill is not paid, which is the 20%, and then services just generally not covered. So that's what you have to think about. This is when we use a term, typically in the insurance world, it's called maximum out-of-pocket, or MOOP, right? This could be something, but when it comes to drugs, then it's called TROOP, right? True out-of-pocket. So think about it. At the end of the day, some of this stuff we may not know because we're not actually using the drug yet, but there is a cost assigned to it. So even though things could appear inexpensive initially, what's the exposure? All right, so how much does Medicare cost? So again, Part A, $0 to the self or spouse if you paid into Social Security. If you have more than 10 years working, right, greater than 40 quarters, and there's no cost to you. But if you, for whatever reason, you didn't put in those whole 40 quarters, then there's a premium of $252 if you're between the months 30 to 39. And if you work less than 30 quarters, right? So that's a little over 5 years. So maybe in your entire life, you worked a little bit more of 6 where you've paid into Social Security taxes. Your premium at age 65 for Part A would be $458. All right. So that's for the hospitalization. So, but for 99% of the people on this call, it's going to be $0. Part B is the cost, and it's $144. But you see that bullet there, it says plus income-related adjustment if applicable. Some folks could put themselves in a position to have additional or increased premiums. And then Part D is paid to the private insurer. It varies with the plans, but it's also, Medicare Part D is also income and means tested. So Medicare Supplements, this is also known as Medigap. Before I go any further, I just like to use this visual. Think of Medicare, what I've talked to you thus far. And when I talk about Medicare, I just mean original Medicare Part A and B. And I want you to think of it as a colander, that kitchen utensil that we use when we're, straining spaghetti, linguine, or lettuce or vegetables, right? We're rinsing off in there, and we pour water in there, and it flows out the bottom because it has holes. I want you to think of original Medicare as having holes in it. Those were all those costs that I was talking about earlier. The reason you want to start to think about when you come off a fully insured plan through your employer and you become eligible, that you now need to start to think about, how do we fill those holes in the colander? And there are different ways to do so. And what I do is I basically parse it out. We can do one of two things. We can either go out and look at Medicare Supplements or Medigap, and they fill in those holes. That's why it's called a gap, filling in the gaps. Or we can go back to that Part C, which is Medicare Advantage. And then there are, different companies and carriers and different levels. You're trading or offsetting and mitigating the risk with the insurance companies. Neither is necessarily better. I tend to lean towards the Medicare Supplements because most of the Medigap plans allow for an open network or a very broad network, whereas quite often the Medicare Advantage plans, we have a tighter network that we have to stay within. So how much is Medicare? So what is the Medicare Supplement? Unlike original Medicare, Medicare Supplement plan is offered through the private insurance companies. Insurance companies are required to offer the same basic benefits for each letter plan. So this is where it gets really confusing. And I normally would write this on a whiteboard. So we've talked about the letters of the plan, A, B, C, and D. Well, in their infinite wisdom, when they started creating supplemental plans, they started creating A, B, C, F, J, K. So they got more letters, and some of them are redundant. Now, as of this year, I used to promote Plan F as the number one plan of choice for me on the supplemental side, but that is no longer available. I've been saying they were going to take it off the market. If you have it, you can keep it. If you don't, you can't get it, right? So we have to look at other plans that can help fill your needs. But Medicare supplement plans help cover the gaps in the original Medicare. So they help pay those co-payments. They help pay that co-insurance, and they help pay those yearly deductibles. We just looked up today, Horizon Blue Cross Blue Shield in New Jersey for a Medicare plan, roughly about $153 a month for a preferred female. I think it was 65-year-old female. So we can always look at this, and this is part of what we help you to do, is to navigate this arena. So these are the advantages, pros and cons. And so you turn around and you look at, okay, option one, Medicare supplement plan or Medicare Advantage plan. Does it have a monthly premium? Notice always with the supplemental plan, because insurance is not free. When you see Medicare Advantage plan, it says sometimes, that's where you're going to get literature in the mail that says, oh, zero cost premium plan. And again, we've already gone over that. There is no such thing as a free lunch. Option one, Medicare supplement plans, does it include Plan D, a drug plan? No, you must buy it separately. So if $153 was for Horizon's, Plan F, which is going away, and you wanted to buy the formulary offered by Horizon, it's $115 a month on top of that. So keep that in mind. But the Medicare Advantage plans will say, oh, our drug plan's included. Out-of-pocket co-payments, no. With Medicare Advantage, this is where you start to see a whole lot more yeses on the rights, because they're not going to get you up front. They're going to get you in. And then later on, as you have claims, you're going to be finding you have a lot of bills. This one here, where it says travel. So if you travel, can I travel and use any hospital or doctor in the country? I mean, I don't know about you, but if I were to become ill and we weren't in a COVID-19 environment and I needed a good surgeon or something, I just want the freedom to be able to go. So it's important to me. I don't know about you, but just understand that with the Medicare supplement plan, we don't have that network or restriction versus Medicare Advantage plans. Most times you do. And can my plan remove my doctor from the network? So here you pick your plan because your doctor was taking it. They get into contract disputes, and next thing you know, your doctor leaves, and then what do? So just understand what you're looking at. If you'd like help in the future with selected Medicare plans, we can help you, right? We'll help you to navigate this arena. If you know anybody that has questions, don't keep this a secret. So this is my CYA, right? So this is, we have to put our disclosures that we're not giving any investment advice. This is purely educational. And I want to thank all of you for taking time each and every week. If anybody here needs me, there's my email. Just send me an email. I'm always available. And I want to wish everybody a safe and great day. Thank you very much for spending time with me today.